So today I'm going to talk to you a bit about jowls. They're one of the most common concerns that patients come to see me with in clinic. What is a jowl? Well, a jowl is this little pocket that sometimes develops along a jawline. So it's that area of looseness, often can feel a little bit like a fatty pocket along the jawline, and they commonly develop as we age. Now, jowls are one of the most complicated areas that we treat in clinic because they're not just caused by one thing. As we age, it happens on every single layer of the face. So we know that the skin loses collagen as we age and that this makes the skin looser. But in most people, jowls aren't just skin laxity. So as much as we can treat with skincare products, we can treat with energy devices that tighten the skin and stimulate collagen, they'll often leave you underwhelmed if you do that alone. Now, with the help of my little friend here, I'm going to explain a little bit about what happens as we age. So this is the cheekbone or the zygoma, and that deflates and we lose bone as we age here. Now, the jawbone changes quite significantly, and where you can see in this skull that it's quite rounded here and defined in shape, as we age, that becomes sort of further forwards and more sloping because we're losing bone there. The jawbone as a whole also shrinks, and the chin does in particular. It becomes often a little bit shorter and almost develops a ledge or a ridge where it can cause that chin muscle to rotate upwards. So these bony changes all play quite a significant role in the formation of jowls, because if the bone at the cheek shrinks, it means that our fat pads start to fall forwards, causing the nasolabial fold, the marionette line, and the jowl. Now, the loss of bone along the jaw is extremely important because that loss of tension in the tissues around our jawline mean that we can get that folding or jowling. And it particularly happens here because we have a ligament that runs here, a facial ligament that holds things there. And so it doesn't fall right the way forwards, it sort of stays in this pocket here. Now, although most of our facial fat pads become smaller and deflated as we age, our jowl fat pads can actually become a little bit fuller, so that can play a role as well. So as you can see, it really is every layer of the face that's playing into the formation of jowls and their development, which also means that if we're going to treat them, we need to use a multidisciplinary approach. I'm a big fan of combining skin tightening for the skin layer, be that through something like soft wave or the profound radio frequency device. They're both excellent for treating this area. Strategic filler treatments, so reflating those fat pads that have become deflated with time, or using an injectable called Harmonica, which is a hybrid injectable that we can use to, again, restore volume, but also to stimulate some skin tightening, can both deliver great results. We could use some strategic fat reduction treatments like the cool sculpting for under the submental area, or fat dissolving injections, again, underneath this jawline to help reduce those little jowl fat pad pockets, and that can be quite a useful treatment. The important thing is really to think about a holistic approach. I hope I've explained today why the jowl area can be quite complicated to get good results on, and you have to expect a treatment plan that's going to cover a lot of these angles, and this is why an expert assessment is so important. You need someone who will look at you, who will look at why this has developed in your face and treat you with the appropriate tools rather than using a one-size-fits-all approach. That real assessment of why it's happening in you is so important. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.